Welcome to lesson number 1 of module 5 of the Healing Brain Masterclass, Traumatic Brain Injury, Concussion. I'm your host, John Malanka with The Sacred Plant. And did you know that a concussion can happen to any of us? As children, especially in California, we skateboard and surf, and injuries can easily happen. As adults, you can be flying on a plane and an overhead bag falls on your head. In this lesson, we'll cover the what and how of concussion. We will learn the reminder and why it is so important to use helmets during sports to prevent head injury and explore the new possibilities of treatment as well as recovery by using medical cannabis, this powerful, sacred plant. Welcome back, Dr. Stein, and welcome back to our Sacred Plant family. Today we're going to talk about traumatic brain injuries, and we're going to feature the topic of concussions. Can you touch up on this? And we're hearing it every day in the news now about something, either a young child playing Pop Warner's football, skateboarding, to NFL, to elderly even having falls. Can you talk about this subject?
It's a hugely popular subject. Everybody is very tuned in to head injury right now because of the recent awareness that pro football players and other professional sport players can develop this chronic condition as a result of head injury. Concerned parents want to know if their Pop Warner playing kids are going to develop those types of problems. And I see patients and get phone calls almost every day, something about concussion. We work a lot with the student athletes here in Sarasota, and I have met with the trainers, and when they have a situation, they call me or text me. We try to provide immediate sideline advice, as it were. It's very important, and I'm happy to talk about it.
Yeah.
In brain science, we have learned that trauma to the brain is a bad thing. And that seems intuitive. What we're learning more and more about is exactly what trauma does to the brain and how repetitive traumas can be particularly problematic. For example, in football players that are on the line, they're colliding with other linemen, play after play after play. And those hits may not trigger a concussion, but they are also triggering something that happens in the brain with the molecules and the neurons, and we'll talk more about that. But the point I want to make with that is that a concussion is a biomechanical event that results in a change in behavior. Someone may get a hit and then they stagger off the field. That's a concussion. They're staggering. Someone may get a hit and then they're seeing stars and they're confused. That's a concussion. That whole behavioral and experiential thing that happens after a collision is a concussion. That's your brain telling you, hey, something's not right here, something's not working. In professional sports and amateur sports, for that matter, when collisions occur, one right after another, and there's a sufficient force to disrupt the nerve function, but not sufficient to cause symptoms, we call those subconcussive blows. Now we're learning that repetitive subconcussive blows can also lead to nerve injury.
Wow.
So even if you feel good, you're playing, you feel great, and then you work real hard at your sport for maybe 4 years, there's a potential for brain injury, even if you never had a diagnosed concussion.
Hearing you, I'm thinking back of all the times I've crashed or hit my head or had been kind of dazed and confused. And I remember one time I shared a story with you yesterday. We were in Montana and I banged my head and, I went to bed and Corinne woke me up, every few hours to make sure I was okay, which you're saying is not a good thing to do.
We know now that when someone has a brain injury, you want the brain to rest. And if someone is sleeping...
I was trying to rest.
You were trying to rest. And she was concerned that something might happen.
Yeah.
So, the old advice was to wake the patient or loved one up and make sure that they're still okay. If someone goes to the emergency room with a severe head injury and a CAT scan is done, if bleeding is ruled out and the physician says you're okay to go home and rest, you do not need to wake that person up.
Okay. So what are some of the vital signs you look for? If I'm with you and something happens, God forbid, but I look at you, do I and you're on the ground. Do I look? Is there something I look at your eyes? Can I look at your body function? Can you give us some tips on that?
The first thing you need to do in trauma is to make sure that the person's airway is safe, that they're breathing properly, that their heart is working. We call that the ABCs, basically.
Okay.
And if their heart and their breathing seems okay and they're waking up, you have to make sure that they don't have a broken neck before you move them. So we're just talking about now standard emergency medical service type protocol.
Uh-huh.
If it's not anything like that, if it's not nearly that severe, and the person gets up and they seem okay, you can guide them to the sidelines.
Yeah.
And then do a sideline assessment. For example, ask them where they are, ask them what the score of the game is, ask them to move their eyes. We do a sideline assessment that checks cognitive function, eye movement, and balance primarily.
What about dazed and confused? I was recently with a friend, and they, those little scooters that you're seeing all over different towns, and we were going, and they took a spill and went flying over the handlebars.
Mm-hmm.
And thank goodness it was grass to the left of the trail, and full-on skid marks, lying on their back, completely dazed and confused. Got up. Didn't really know where they were, but days later, they were still kind of confused. They said, "I think I had a concussion." What do you do about stuff like this when they don't want to go to a doctor?
That was a concussion.
That was a concussion.
That was symptoms following head injury. Yeah. That's a concussion. Yeah. You can rest at home and give the brain a chance to heal. The important part about concussion care in the acute phase, within the first several days, hours and days, is to avoid another concussion. That's the key. What happens when a concussion affects the brain, or I should say the brain experiences a concussion, the nerve cells may swell up. There's edema in the brain. There's a glutamate release, that chemical that causes the excitotoxicity. The blood vessels don't react properly. The mitochondria, remember the mitochondria we learned about in high school, those energy machines in the cell that produces all the ATP for the energy, those stop working. Okay. And so it's super important after a head injury that includes a suspected concussion to rest at least for a day or two, maybe 3, depending on the symptoms.
Okay.
So that a second injury, will not occur, because that can be catastrophic.
So are there tests for traumatic brain injuries? When would someone go in and get a CAT scan?
A CAT scan is indicated if symptoms include things like double vision after head injury, nausea and vomiting after head injury, and a headache that seems to get worse. Okay. Those are all symptoms of a more severe head injury. Some patients after head injury develop a brief seizure. I think many of us have seen, but maybe not recognized, what happens during Sunday football with some players, that after a collision, they lay on the ground and there's a sudden, arm extension. That's actually a post-traumatic seizure. That happens.
We see that in MMA a lot, quite a bit. They're knocked out and
then the arm goes up. That's a seizure. That's a post-traumatic seizure. That person needs to go to the hospital and avoid another collision until they're completely well. So it can be serious. Yeah. Usually it's not, thankfully, but it can be. And so you have to look for those warning signs.
Are you seeing a lot of research? I mean, I know we're seeing concussions and warnings, not only in youth football, but even in the NFL. They've changed new laws on how to hit. They have new helmets, new equipment. To a lot of times for certain positions, have instead of having their head slammed back, they have now padding and more support, more cushion in the head, in the helmets. And so, what are you seeing when it comes to concussion research?
Those modifications in helmet design are important, but I'd like our listeners to know that helmets do not prevent concussions. Helmets prevent skull fracture or damage to the teeth and jaw. But what happens with a concussion is the head is being moved rapidly in one direction or another. you can actually get a concussion from a blow to the body, and then the impulse wave causes the head to move.
Whiplash type of stuff?
A whiplash type of thing, and the brain moves. That's what causes a concussion. Military personnel that are exposed to an explosion suffer a blast wave, right? That blast wave has power in it that causes a reverberation of the brain substance, causing a concussion. So these are things that cause concussion. It's the movement, sudden movement of the brain. And when you're wearing a helmet, that protects the skull from fracture, but the head still gets jarred in a significant way, especially when you're taking a hit from the side.
Yeah.
So I appreciate that helmet technology is improving, and there's some mitigation of concussion risk, but helmets do not prevent concussions, just so we're clear.
So do you see a lot of your patients coming in here, non-football players, non-athletes, but coming in here perhaps having a fall from stroke, Alzheimer's, Parkinson's, MS patients?
Boating.
Especially down here, huh?
I had someone the other day who was walking down some stairs in their boat and slipped and fell forward and conked her head on the door, and she had a concussion. Concussions can happen to anybody. Of course, you want to reduce your risk, but it happens.
Yeah. Let's talk about conventional medicine. Is there anything that conventional medicine can do to help bring your brain back to homeostasis?
Not a whole lot. It's usually the brain healing itself.
Okay.
When patients come in with concussion, we try to just get out of the way medically and let the brain heal. Prevent another head injury, prevent overstimulation of the brain function. So, for example, young student athletes, we keep away from schoolwork for a day or two at least, because those mitochondria we were talking about, they don't function normally for a day or two, sometimes longer. And when you start thinking about your schoolwork, for example, that can actually bring on symptoms of headache after a head injury, indicating that there's still a concussive process going on. So we stay out of the way, we avoid another impact, we let the brain heal, and try not to put too much stress on the brain. The reason we're allowed to do that, John, is because our own body's physiological repair mechanisms are hard at work. And our endocannabinoid system we're learning now is one of those key players in neuronal cell recovery, reducing excitotoxicity, and helping with nerve repair and regeneration in some cases. It's a beautiful thing.
So, leading into cannabis for brain injuries and concussion, is it beneficial to use cannabis after? I mean, hopefully, like my friend who took that fall, he had a major traumatic brain injury, and his doctor said, because you're an avid cannabis user, it saved you here, which is probably 1 in a trillion in his case there. What's happening with your patients? What do you recommend medical cannabis to concussion patients, and why?
We have seen that in other individuals who use cannabis prior to a head injury, there may be a protective effect.
Okay.
There was a study performed that looked at that. I'm hoping that our own endocannabinoid system is sufficient to help us repair and protect us from too much injury. But it's potentially useful to add phytocannabinoids, cannabinoids from the plant, and help with the repair process, reduce neuronal damage from excitotoxicity, and so forth. We're learning still about that. We don't know that giving someone cannabis therapy after a head injury will be helpful. We don't know that yet in humans. What we do know is in preclinical laboratory evidence, after a head injury, there is a massive activation of the endocannabinoid system, which means our cannabinoid system is helping to repair what's going on there. If we supplement that with additional cannabinoids, like using medical cannabis, theoretically, it could provide additional benefit.
So is there any time, are you a believer of precaution and taking a wellness dose?
I'm learning more about that, and I think I'm coming over to that side of the tracks. I have started using some wellness doses of THCA myself. I'm impressed with the literature on that. I can't make those recommendations broadly because I don't think we have enough evidence in humans about that. But we do know that in the laboratory, wellness doses or supplemental cannabinoid doses can only really help what we do in our own bodies.
Yeah. Thank you, Dr. Stein, and thank you for listening in. We're going to move on to our next lesson, which we'll talk about more chronic head injuries, numerous chronic head injuries leading to CTE, and we'll see you there. John Malanca with the Sacred Plant with Dr. Daniel Stein. Thank you. Remember, keep our loved ones safe. We can all bump our head here and there, but we have to be safe in all the things we do, including wearing a helmet when necessary, being mindful when performing action sports, and of course, keeping a lookout for signs and having regular checkups with your doctors. As we learn, repeated brain injury can lead to even more dramatic outcomes like CTE. These findings should make us pause and wonder, am I doing enough to take care of my brain and the brains of my loved ones? We'll continue our discussion on impact-based brain injuries in our next lesson, CTE,